Vanakkam. Mental health should have the same priority as physical health and should be made a global development priority. But lack of consensual definitions of both these terms, mind and health, creates enormous challenges in understanding, prioritizing, and promoting mental health. Theoretical foundations of psychology are flimsy. Theories in psychology rise, fall, and fade away, formulated so vaguely or abstractly, making it difficult to test in order to prove them right or wrong, in order to accept or reject them. Psychologists should be taught how to build better theories. In today's world, most of the students are not willing to accept psychological theories or any theories on the basis of faith, authority, literacy, elegance, or popularity. So, what's going to happen to the field? Psychopathology and psychotherapy, another set of terms that lack a common definition and are loosely employed in scientific articles and textbooks. Any attempt to define any of these two terms presuppose that we really know what mind is, how mind works, and what normality is. In fact, we don't know. Surprisingly, after all these years, little is known about what psychologists do in a therapy session and the following other things. What techniques are used by the therapist, the similarities and differences among those techniques. How therapists decide the treatment plan, how therapists incorporate the conceptual model of cultural adaptations of psychotherapy into their practices, the mechanisms underlying successful outcomes. What characteristics of the client and therapist predict progress? Many studies have found that having a good therapeutic relationship between client and therapist and the client's willingness to make changes are better predictors of outcome than any specific framework or technique. But little is known about the development of the alliance, and very little is known about the therapist's attitude and beliefs about psychotherapy research. After all these years and of all the questions, the cardinal question that has no consensual answer out there is this: what the subject matter of psychology is. For it has been variously defined over the course of time, from the science of soul to the science of consciousness, mind, mental processes, behavior, and all that jazz. From the subject matter to the core concepts of psychology, to the theories and practices, nothing has a consensual answer. Only a negligible amount of progress is made cumulatively. Why? Only very few cardinal problems are recorded in the scientific literature, such as improper assignation of fame to certain scholars and studies, cognitive rigidity of the professionals, dogmatism, and gatekeeping famous scholars. I am fully aware of the heart problem, the non structural aspects of the psyche, consciousness, mind, and so on, which is a great obstacle to objectively observe, study, measure, and understand and bring consensus. The field is fragmented, it has to be unified. Theories are fragmented, they have to be unified. Practices have to be documented for the assignment of treatment integrity and to serve guidelines to devise treatment protocols whenever necessary. The focus of the field has to be shifted and the direction of the researchers too. It is possible to tackle all these problems within 3 years with the help of Seaboyd, the grand theory in psychology. Nandri.